yeah, I'm happy because I got a mom and the kids are going back to school.
Yes, hallelujah.
Back to school time is coming up after Labor Day weekend.
And it's a good time to think about your child's eyesight. Vision problems affect the ability to learn.
It is important to talk about it. So here to talk with us about some of the issues is pediatric ophthalmologist Dr. Tamiesha Frempong. She's with the New York Eye and Ear Infirmary of Mount Sinai. Welcome and thanks so much for joining us this morning.
Thank you. Happy to be here.
We have to ask, what's the most common vision problem among children that you see in your practice?
Myopia, nearsightedness. There's an epidemic of myopia, and the concerns are that it puts people at increased risk for things like retinal detachment and vision loss. So it's something to address.
But how do we know that our child actually has eye trouble? Because I think I'm the reverse of normal parents. Kids don't tell them that they need glasses or that they want glasses because they don't want to wear them. My kids were the opposite. They're like, I want glasses. And I just thought it was because other kids were getting them, that they just wanted to be in the in crowd. How do you tell? Like, they really are having issues seeing.
Yeah, it can be hard. I'll tell you for myself, when I was in the 3rd grade, I started failing my spelling tests because I couldn't see well. And my teachers told my parents, you should probably get her eyes checked. And sure enough, I'm nearsighted. I have myopia. But yes, for kids, sometimes they don't know. It may not be that they don't want to wear glasses. It may be that they're unaware. It's so subtle that this may be their norm and they just struggle through it. But other indications would be if you see your kid squinting a lot, if your kid needs to be closer to the TV. Those are some indications that, they may have a problem with their distance vision. Kids can also have a problem with their near vision as well. And so if they're resistant to reading or doing near work, that's another indication to have them checked out and they may need glasses.
That's such a good point. It's so worrisome because if kids are having a problem with their vision, it could also affect their confidence, not only just their schoolwork. I know that there's like contact lenses to help prevent nearsightedness. Is that right? Explain how that works.
So it doesn't exactly prevent nearsightedness, but it does prevent the worsening of nearsightedness. There are many mechanisms, but specialized contact lenses. One is called MiSight, which is a dual focus contact lens. There are other types that work similarly. And basically what they do is they prevent the progression of myopia. And there's real evidence that it works quite well. It's a disposable contact lens. Kids wear them every day, take them out at night, so they sleep without them. And it has been shown to significantly decrease the progression of myopia.
My daughter, who is 10, actually has those contact lenses. But how young can you be to start using them? Is there too young of an age to start using those kinds of contacts?
Good question. Yeah, earlier and earlier, kids are wearing contact lenses, just not even for myopia control, just because for vision correction. And they're into sports and dance and gymnastics and all kinds of activities that require them to wear contact lenses. In general, kids around the age of, say, 12, 13, that's about the time that they start wearing contact lenses. But for this study, it was studied in kids for these specialized contact lenses as young as 6 and 7 years old.
Oh, wow. And drops too, right? There are drops available?
Yes, there are drops. It's a type of drop. It's called atropine. It's used in the dilute form. So the full concentration is 1%, but it's used anywhere from 0.02% to 0.05% has been shown to be very effective in slowing down the rate of progression of myopia. That's a drop that's used every night at bedtime. It's very well tolerated, very few side effects. So choose your poison. They both work. It just depends on your kid and sort of what you want to use.
Wait a minute. So for those contact lenses, would a child as young as 6 years old be like putting it in their eye, or do they need help from a parent?
Yeah, exactly. So the parent would be the one to have to put it in. Yeah, and so sometimes that's challenging, right?
Yeah.
Because anytime you're putting anything near your eye, your knee-jerk reaction is to close your eyes as a protective mechanism. So not all kids can tolerate contact lenses. And then there's the issue of access, right? They're costly. It's not covered by insurance typically. And then it becomes, an equity and access issue. Even for the drops, they're often not covered by insurance.
Yeah. We have to ask, computer screen time is a thing. It's not only for kids to relax, but nowadays schools are incorporating computers and screens, iPads for a part of their work and homework. So how much time is too much screen time?
Yeah, it's about the time, how, the uninterrupted time. So every 20, 30 minutes that they're on these devices, they really should take a break. Also, these devices, kids, because they have such powerful eyes, like to hold the devices very close to their face. That's also a problem in terms of contributing to myopia development and progression. So we know these devices should be held at least 30 centimeters away from the face, and they should take frequent breaks. Now, the evidence about whether or not these devices themselves are problematic is still sort of questionable. We know that it staying inside too much can also cause myopia progression. And so there's real evidence that outdoor natural sunlight, at least 2 hours a day, can decrease the rate of progression and even onset of myopia.
Wow.
So holding devices too close, being on them uninterrupted for too long, and staying inside too much are the things. Those are the low-hanging fruits that families can do and kids can do to help themselves in terms of myopia development and progression.
Wow, that's fascinating information. Dr. Tamiesha Frempong, thank you so much for joining us this morning with all this interesting information. We appreciate it.
Thank you. Kids, get your eyes checked. Wear your glasses if you need them.